everyone. My name is Brandi Steverson, and I'll be doing my presentation over endometriosis. What is endometriosis? It's a painful condition in which tissue similar to endometrial tissue, the tissue that lines the uterus, grows outside of the uterus. The hormone changes within the menstrual cycle affect the endometrial-like tissue, causing inflammation and pain in the area. What this means is the tissue will grow, thicken, and break down. Eventually, the broken down tissue has nowhere to go and becomes trapped within the pelvis. The tissue can grow in these common areas: the ovaries, fallopian tubes, and the tissue lining your pelvis. However, this tissue can grow anywhere in your body, such as your urinary tract, rectum, and other areas. Those who have endometriosis are likely to have issues with infertility and the ability to get pregnant. Statistics of women globally with endometriosis. Typically, this affects about 10%, or approximately 190 million of reproductive age women globally. 20 to 25% of patients are asymptomatic, meaning they don't have any symptoms, but yet they have it. This occurs in 6 to 10% of the female population, and it affects more than 11% of women between the ages of 15 and 44, but it's especially common in women in their 30s and 40s. Here we got a few other statistics. 40 to 60% of the women have severe menstrual cramps. 70% of women with endometriosis experience pelvic pain. 25 to 40% of the women are infertile, and up to 15% of the women are of childbearing age. Endometriosis can occur in women of all ethnic groups, and it can also occur if, say, your sister or your mother has it, you're more likely to get it as well. Symptoms common with endometriosis are painful periods, heavy menstrual bleeding or bleeding between periods, pain during or after sexual intercourse, chronic pelvic pain, painful urination or bowel movements, fatigue, anxiety or depression, bloating of the abdomen, nausea, infertility, and lower back pain. Here is a little diagram of like what a normal uterus and pelvic area would look like, and here's what your endometriosis looks like. These are like little lesions. How can endometriosis be diagnosed? The most definite diagnosis is through laparoscopic surgery to biopsy the affected tissue. This is achieved by making 2 to 4 small incisions into the abdomen, creating ports inside the abdominal and pelvic cavities, which are then inflated with sterile CO2 gas. The doctor will then use a laparoscope, which is a camera, through the ports to examine the tissues and organs in the cavities. A focused pelvic exam is typically a preliminary step in the diagnosis process as well. An ultrasound may also be a way to gain additional information, and it's sometimes even done during the initial visit or the pelvic exam. Here is a picture of the anterior portion of your pelvis, and here are the little endometrial lesions. There were several other more progressed pictures I could have chose from, but I went with more of a mild type case. Treatment of endometriosis. Endometriosis has no cure, but its symptoms can be managed. Treatment options include over-the-counter pain medications such as ibuprofen, but this isn't always effective. Hormonal contraceptives, these decrease fertility by preventing the growth and buildup of endometrial-like tissue each month. Hormonal contraceptives are like your birth control pills, patches, your IUDs, as well as like the depot shot. The depot shot also helps in kind of stopping some women's periods, not all, but some. But all of these contraceptives are good for like pelvic pain and things. Like a lot of them help with that. Hormone therapy, which is done by taking supplemental hormones, which may often decrease pain and stop the progression of endometriosis, and it also helps by regulating monthly hormonal changes that promote tissue growth. A medicine called GnRH, or gonadotropin releasing hormone, which suppresses estrogen production, and it in turn stimulates the ovaries. Surgery, a more mild surgery is a conservative surgery. It's used to remove and destroy endometrial growths or lesions without damaging the reproductive organs. This is more for people with mild cases, but also for women who still want to get pregnant. A hysterectomy, which is what they call a last resort surgery. The patient may be recommended to have a total hysterectomy where the uterus, ovaries, and cervix are removed. Since ovaries produce estrogen and estrogen can cause endometrial-like growth, it makes sense to remove those too. A hysterectomy can treat endometriosis, but it isn't a cure. So like once the procedure is done, you can no longer get pregnant as well. Possible causes. There are several theories as to the cause of endometriosis, but none have been scientifically proven. One of the oldest theories indicates that a process called retrograde menstruation, which occurs in 90% of women, is the culprit. This occurs when blood backflows back through the fallopian tubes into the pelvic cavity during menstruation instead of leaving the body through the vagina. Another theory indicates that hormones transfer cells outside of the uterus into similar cells to those lining the uterus, which are known as endometrial cells. Others believe it may occur if small areas of the abdomen convert into tissue resembling endometrial-like tissue. This can happen because cells in your abdomen grow from embryonic cells, which change shape and act like endometrial cells. The development of endometriosis may also be linked to genetics or environmental toxins. Can endometriosis be prevented? Endometriosis can't be prevented. However, you can reduce your chances of acquiring it by lowering the estrogen hormone levels in your body. Estrogen thickens the lining of the uterus during menstruation. If your estrogen level is high, it causes the endometrium to be thicker, making you have heavier bleeding. To manage lower estrogen levels in your body, you can talk to your doctor about hormonal contraceptives. Exercise regularly. By keeping a low percentage of body fat and regular exercise, this decreases the amount of estrogen circulating throughout the body. You can avoid large amounts of alcohol, as alcohol raises estrogen levels, and also avoid large amounts of caffeine, especially sodas, as it can also raise estrogen levels as well. Here are some coping strategies. You can limit physical activity during menstruation. Increase your knowledge about endometriosis. Schedule work and social activities around your cycle. Reduce stress. Join an endometriosis support group. And get your gynecological exams regularly. That's very important. You should always stay on top of that. Especially if you notice changes with your female health or if you show 2 or more symptoms, you should definitely get yourself seen about. And that's the end of it. Thank you all for hearing me out today.